everybody. All of us have something about our bodies that we don't like. We have two choices: live with it, or if it bothers you that much, get rid of the problem. Stop talking to your girlfriends about it. Our next guest didn't like her midsection, so she decided to take advantage of a new procedure that gets rid of fat by using water. Please welcome Roxanne Villarreal, along with Dr. James Kern and Tony Navarro with the Image Enhancement Center. Okay, what was it that you weren't liking about your midsection?
The bigness.
The bigness? Okay. I think we have some before pictures of this, right? Okay, let's show some before pictures of this bigness. Okay, so it was like full, and when you sat down,
the
you had
bottom part, and then the top and the sides. Yeah.
Okay, and then when you sat down, you started the jelly rolls came.
Yeah.
Okay. A lot of us can relate, yes, but just from the side, you can see where that rippling there has gone away. Okay, we're familiar with liposuction, Dr. Kern, but what is this particular procedure?
Basically, it is a form of liposuction. It's considered water-assisted liposuction. We use not actually water, but normal saline, which is physiologically balanced with the body chemistry. And using spurts of normal saline, we're able to separate the fat cells from the connective tissue in the body, so that when we suck the liquid out, the fat cells come out with it.
Yeah, so it's not as aggressive as the old-time liposuction we've seen before.
It is not at all. Actually, it's quite gentle. It's so gentle that we are able to trap the fat cells a little bit later in the system, and if need be, reintroduce them. So we can use these fat cells, the patient's own tissue, to do a breast augmentation, to line the lines in the face, to soften the hands.
Yeah, wherever you want to plump out.
Yes.
Oh, look at that. Okay. I'm going to get you to stand up and unbutton your jacket because, again, you went down a pant size, and then you have your immediate results, but then you almost lose a little bit more even after the swelling goes down and stuff. And so there you go. It's much flatter now for you, and you've actually gone down a pant size.
I actually bought these jeans the day after, and they were a little snug, and now they're a little...
Now they're fit.
Yeah.
All right. And we're looking at the picture again. Okay, so the question I got to ask now is, what about recovery time?
Well, that's the great thing about this procedure, too, Deborah, because most of our patients end up going back to work a day or two after the procedure.
Wow. As opposed to the other procedures where it would take weeks to recover,
you'd be
right?
flat on your back in the bed and really not doing much moving for at least 3 to 4 weeks on some cases. So this is nice. It allows you to get that more sculpted look, not a lot of downtime. And I remember on the video that we had here earlier on the earlier program, you were talking.
Oh, yeah.
Yeah, you
I
are
really
awake.
did go shopping. I told her I was going to go shopping the next day, and I did. I walked around.
Yeah. All right. And you've actually had this procedure done as well.
Yes.
So stand up.
Do I have to
see
stand
you.
up?
Stand on up.
All
Let's
right.
see here.
Okay.
Wow. And you had a little bit less to remove, but for you it was about, for you lost, what, 10 pounds of fat? About 10 pounds of actual fat in the localized section. And for you just want to kind of sculpt. So this is good for a couple of different reasons, whatever your reason for wanting to remove that fat.
Yeah.
But the cool thing about this, too, is you can spot reduce, which normally with exercise, if you do exercise, you can't necessarily spot reduce.
It's used to eliminate those areas where the patient has exercised and dieted and worked herself virtually to death and still has this roll that she can't remove.
Yeah. All right. So once that fat is gone, is it gone for good?
It is gone. The fat cells are removed, and this fat is gone.
And for you, I guess you're happy with the results, aren't you? Yeah. And when we say 10 pounds of fat, people might think 10 pounds. They're not thinking that this is not the overall body. It's one localized section.
Right. If you're taking 10 pounds out of right here, or this combination, instead of thinking all of me 10 pounds, that is a big difference.
Yeah.
So you're really concentrating it on those problem spots, and that's what that procedure is for with the body jet.
Okay, like the bra fat. We were talking to the commercial break. You have no idea what goes on to the commercials, people. We were talking about that bra fat area is a big one. And so, okay. So cost-wise, how does it compare to the old way of doing lipo?
It is cheaper, I will say, because it doesn't involve general anesthesia. Plus, this is something that can be done in the office rather than in the hospital.
Yeah.
And generally, it is simply cheaper.
Okay. You all have some other stuff that you offer there as well. See, I love walking into these centers because you walk in and you can walk out a whole new person because they do everything, right? But one of the things that you want to talk about is like now we have the body looking filled and tighter, having the face look tighter as well, and it's Radiase. Tell us what Radiase is.
Radiase is a filler. There's numerous fillers for the various lines in the body, but Radiase is a special filler that we can use. Especially we can use it to plump up the cheeks or return the apples to the cheeks, which give almost a mini facelift. It helps smooth the lines as well as to lift the cheeks.
Yeah.
Basically, as we get older, we lose the fat. The fat drops in our faces. So that we're putting in the Radiase, plumping up the cheeks, and smoothing it. And of course, after the cheeks, if there is a bit of Radiase that we have still to use, then we may put a bit more in the lines in the face.
And this can last about how long?
This usually lasts about a year.
Wow, so a little bit longer than some other things.
Actually, this one can actually go to 18 months. Yes. And what we do is we do a couple of syringes. It usually takes a couple. And then we give a third one for the touch-up. And if you keep doing your touch-ups, then you can make it last even longer.
Okay.
Yeah.
All right.
Yeah, so it's a nice way to do things, and I think that, it can be affordable for everybody. Looking your best and feeling your best, it's all the total picture of you, and inside and outside. And some of these things can really be very inexpensive to do.
Well, some people in our audience will be getting $50 gift certificates. So how about that? Thank you all very, very much. Exciting. For more information on the services the Image Enhancement Center offers, you can call them at 713-774-6243 in Houston, or there's a Katie number, that is 281-599-8900. Okay, you can also log on to imageenhancementcenter.net. Thank you all very, very much. All right, coming up next, a smile may be the first way we greet people.